Are we live? Can you see us live? Oh, there we are. Okay. Hi, everybody. Welcome to Inside Scoop with Sue. I am personally so grateful for this guest today because I think I might be suffering from long COVID. Now, we're not going to be talking about me, although, boy, I would really love to. but we're going to talk about teens and long COVID because they are the stories I was reading. They're really suffering. So, Dr. David Miller, you have so many letters after your name. I'm going to give a short intro and then you can explain a little bit about your background because I believe that your training is very unusual. So, you are dually board certified in pediatrics and Chinese medicine, and you're licensed in acupuncture. I don't know if those are tied together to the Chinese medicine.
It is. Yeah, that's tied together. Yeah.
Okay. And then what's your title?
So I'm the director for pediatric integrative medicine with Connor Whole Health and work with Rainbow Babies and Children's Hospital. I'm co-directing the pediatric long haul COVID recovery clinic with Dr. Amy Edwards.
Okay. And you are at University Hospitals in Cleveland, Ohio.
At University Hospitals in Cleveland. Absolutely.
You're right. Okay. So let's just start with, is this thing that's happening a lot in teenagers, long COVID in teenagers?
It is. It's huge, actually, and vastly underappreciated and underestimated. So, we estimate that about 400,000 kids in Ohio have had COVID documented, which means the case has been tested and reported to the state. So, we know there's probably 10 times that, maybe not 10 times, but massive more who have had COVID, never tested, didn't know. And that the numbers range somewhere from 3 to 7%, it seems like right now, should have long COVID. So, up to sort of 28,000 kids. And we've been able to see about 120 so far in our clinic, which is one of the bigger clinics in the country and vastly underserving probably the need.
Wow. So it is, it's its own pandemic.
It is its own pandemic. It really is. Yeah. And it's very, very hard for these young people because it can be somewhat of it's not silent to them, but they look fine on the outside, and so many of them are suffering with, I feel horrible. My testing comes back normal and people think I just have anxiety. And so, we're really trying to get the message out. So I really appreciate your having this talk too, because I think a lot of schools, a lot of other types of professionals and parents and the kids themselves just have a complex array of problems that make them feel crazy. And they actually fit tightly into the long COVID view, but are unidentified otherwise. And they're getting tons of testing and tons of, attempts, but without diagnosis.
Yeah. I mean, some of the stories I was reading is like that typical, chronic fatigue, all of those stories where people were told to go see a psychologist because you have no visible symptoms when you're being tested. So, so what are the symptoms?
Right. So long COVID, it presents unpredictably, after COVID, and people can have a very mild COVID infection. They may even be able to have an asymptomatic COVID infection, or have a very severe one. And, that usually lasts sort of a week to 10 days, week to 2 weeks. And then some people will have a honeymoon period afterwards where for about 1 to 3 weeks after they feel fine, and then they start to tank. And then other people will go continuously from their acute coronavirus infection into long COVID. Long COVID being very loosely defined sort of as lasting longer than sort of 4 to 8 weeks. Some sources will do 12 weeks. So after your acute infection, the symptoms come on. The number one symptom is fatigue. And this isn't usually just fatigue like I'm a little bit tired. This is like I am profoundly tired. Sometimes they can't get out of bed. And then going along with that, there's a condition that's very important to be able to recognize because it's somewhat highly indicative of long COVID, is called post-exertional malaise, where they will do something, they'll take a walk, they'll have a chat with a friend, a small party, like it doesn't have to be anything major, and they'll have a crash event where, normally we would do some exertional activity and we'd sit for 10 minutes or, an hour and we'd feel better. These folks sometimes will crash for hours or days after an event like that. And then, we're also seeing headaches. There's actually over 200 symptoms people have been identified.
Wow. So where's the blood? If you want to send somebody to a resource, where's the best place to go to get like the 200 symptoms when your kid is complaining to you, or you yourself are they different, the symptoms from adults to kids?
They seem to be, yeah. We're
Yeah.
seeing more more actual organ damage in adults. So I don't work with the adult population, for the most part at all, except for people in their young 20s. And fortunately, in the younger people, we're seeing this mostly sort of post-pubertal. We're not seeing sort of the heart damage, the lung damage, some of the other end organ damage that is being seen in adults, often as a result of acute infection. But they still have profound dysregulation. One of the biggest things that they have a hard time with is POTS-like symptoms, postural orthostatic tachycardic syndrome, or we also say orthostatic intolerance or hypotension, where they can't maintain their blood pressure, and so they sort of wilt and many times will faint and fall.
So a feeling of dizziness when they get up, is that like one
It,
of the?
that is one of the big symptoms, right? But it's not dizziness like I'm spinning. It's more like dizziness like I feel like I'm going to faint. It's getting dark. There's spots in front of my eyes, sort of wooziness.
So
And then,
where can someone go? Like,
yeah.
do you have a site where someone can go and find all those symptoms?
So there's a number of long haul sites starting to emerge for kids. Not many of them. There's actually a good website out of the UK, Long COVID Kids, that has a lot of information on it. There's a site out of California.
I think, is it longcovidkids.org?
I believe it is,
Yeah.
And so you can start to learn about some of the symptom patterns there. There's only about 12 clinics that we know of in the country at hospital-based clinics treating kids with long COVID specifically. So this is really sort of just starting to emerge as a treatment domain. So you can call hospitals too, but many times the hospitals are not set up to actually deal with long COVID, and people don't know how to manage it.
Well, so you're at the forefront of this. What are you doing to manage this?
Yeah. So just to mention a little bit more too, some of the other symptoms we're seeing really commonly are headaches, and abdominal pain, sometimes gastrointestinal symptoms, anxiety also, not just situational anxiety, but really sort of a biochemical anxiety that comes up, and sleep disruption, appetite disruption, sometimes loss of taste and smell that persist. Changes in taste as well. So we are managing this sort of step by step, piece by piece, symptom wise. But our overall strategy is one I would say is what we call sort of an optimization strategy. So we want to start and fix everything we can fix about diet and lifestyle and sleep. In order to help the body heal itself. So there are no real medicines, to cure long COVID for sure. We don't know entirely what long COVID is and why it happens. There's many very bright people working on that now, and there's increased funding towards it. So we're optimistic that will come. But right now, what we found, for example, is that, sort of almost as unsurprising and sort of surprising as it is, getting sugar out of the diet makes a huge difference. So we need people to clean up their diets. And that's one thing I would urge everybody to do, right? We're not asking for restrictive eating. What we're asking for is just whole foods eating, like that the food that you're eating is fresh as much as you can, not coming in a package, not from a fast food restaurant, not added sugars in it. And the more people can stay away from really simple carbohydrate foods, the better they seem to do as well. We don't need them to go ketogenic, where they avoid all carbs or only very small amounts of carbs. But certainly the sugar and a predominance of simple carbs seems to flare people pretty tremendously. So a lot of our group will feel considerably better just by changing the diet.
And okay, so just those two changes. And there's
those are the two major changes in the diet. The other things we're doing is we're optimizing vitamin D and looking at iron, because those have been out of whack for a significant percentage of people, which, is it causal or just correlated? We know vitamin D deficiency predisposes you to coronavirus infection, other infections, more severe infection. And many people are deficient in vitamin D. And so we're correcting that. We're finding many people are low in iron, so we can correct that too. The other cornerstone strategy that we're working with is something called pacing, which comes out of what's called the MECFS, myalgic encephalomyelitis chronic fatigue syndrome world. Pacing has been known for years to be a cornerstone management technique for chronic fatigue syndrome. And that involves people really looking at their day, taking some preemptive breaks before they get tired. So what we see is we're trying to help people avoid crashes. So if they can do 2 hours of activity before feeling like they're pushing or they really really can't make it anymore. We need them to rest like at 1 hour. And so it's really changing the way you move through your day to not push yourself into a stress state, which is very hard. We're asking young people to, eat really cleanly, moderate their emotions, moderate their activities, sleep really cleanly, lots of good sleep hygiene. And it's kind of hard.
All the things you would be wanting people to do anyway, but now you're saying that you're seeing a change. So when someone's in crisis, they may be more motivated to do these things.
Absolutely. And then with the dizziness management, we start out usually, depending on the person's history, there can be some exceptions with dramatically increased water and salt. So we ask them to drink 64 to 80 ounces of water a day and increase salt consumption to 6 to 10 grams a day, and often use compression socks, medical grade compression socks. And for many people, that will help with the dizziness dramatically. But if it doesn't, there are a number of medications that we start to add on to that to try to assist.
So those are also helpful. The thing that kind of stands out for me is in my family, it was like a push through it mentality when someone didn't feel good. Like you're going to get better faster if you keep up your exercise and you push yourself a little more than you want to go. And you're saying just the opposite for this?
That's a great point. Exactly. I'm saying just the opposite of that. So the nuance to it is we don't want people to be too sedentary. So if they're too sedentary, they decondition. But if they push in a way that they would have done previously, they will crash, and it seems to prolong their condition. Wow. And so we ask them to function in sort of this envelope of energy of there's a lower boundary and an upper boundary. And you have to figure out how much you can do without feeling like you're pushing, and legitimately try to do things, that you can do, but really be mindful of when you're really dipping into your reserves and then ending up crashing. So it's a learning process.
And is there anything about inflammation that we're dealing with here?
We absolutely think inflammation is one of the core problems that is underlying long COVID, but inflammation can mean a lot of things in terms of where in the body is the inflammation, what type of inflammation is out of balance. But many people who have long COVID basically feel like they have the flu all the time. So they have that feeling of tremendous malaise, difficulty moving, body aches and pains, exaggerated and amplified pain experiences that we all feel when we catch a flu, and you just feel achy and tired and you just want to kind of curl up because you have no energy, which is all mediated by the immune system through cytokines and interleukins and things like that, chemicals of inflammation and healing. But in long COVID, we believe those are very much out of whack and very much not functioning to the advantage of the person. And there's about 5 major theories about, sort of why people feel the way they feel, and inflammation underlies many of those.
So what are there different active steps to do to reduce the inflammation, or do those also align with what you already told us?
They somewhat align with what I already told you. I think, one of the areas of research is, how do we target some of that inflammation? What is it? So there's work being done more at the laboratory level right now, looking at which inflammatory chemicals are out of balance. And then the question though then is, what do you do about them? Because some of those chemicals that are out of balance are things that are treated with the biologic medications, things like Remicade and Humira and some of those. And if you got a handful of those that end up out of balance, you can't put everybody on those really, really intense medications. And, because then you're massively immunosuppressing them as well. And you just can't do it. Like we don't know which one works for who and how to figure out, what that is. So, we try to do dietary management to some degree of the inflammation, decrease inflammatory stressors. For a lot of people,
what are inflammatory stressors?
So like pushing too hard, not sleeping adequately. Sleep is really where your body restores itself and where the immune system really reboots itself and resets. And so when people aren't having restorative sleep, it's actually a huge push towards, inflammation and imbalance. There are some, vitamin kind of strategies too. We basically, hope and help people find like a good sort of multivitamin strategy to support their body. There are foods that are more anti-inflammatory. So we emphasize foods with lots of color to them. Things like berries and dark green leafy vegetables, if they will. Goji berries are an easy snack that have a very high antioxidant value to them. Things like that, which, many kids are fine with. They actually actually really like them. And we could do them in things like smoothies and such. So really kicking up their nutrition to another level for many of them than they were eating previously.
And I think I read somewhere maybe turmeric and saffron. Are those like?
Those are both wonderful anti-inflammatory herbs. Particularly turmeric is known, to modulate inflammatory pathways. So, in a sense, like it's fine if people want to use those. We don't necessarily have formal recommendations for everybody on specific herbs to use, but can guide them on product selection and how to think about dosing and then what to look for. A lot of times, this is such a complex process that it presents differently in different people, and something that works really well for one person may not work well for another. So we try to help people explore safely their different options for self-care, but also help them to remove things that are not working for them so that they don't end up on 30 supplements and 20 medications, because that actually doesn't help and it's usually not necessary.
Is there anything, I read this, but I don't remember where I read it, but that maybe the vaccine can help reduce the symptoms?
So it's unclear. And what we have seen is that in some people, the vaccine does seem to lead to symptom reduction. A number of people have reported resolution of their long COVID symptoms with vaccine receipt. There's a large group in the middle for whom it doesn't seem to affect their long COVID. And then there's a smaller proportion of people who report certainly a flare of symptoms, but some who feel like it really worsens their long COVID long term. I would caution on sort of that number too, because many of us who get the COVID vaccine, like when I get it, I am wiped out for a couple of days afterwards, so it is a stressor on the body, it's a trade-off for that immunity. And when someone's compromised, they may not tolerate the stressor of any medical procedure well, including vaccination. So it may not be that it's actually flaring them in a damaging way. It's just a stressor that takes them longer to get better from, just like if they caught a cold, it would take them longer to get well compared to how they were before they got long COVID.
That's not the sure quick fix to go run out and get your next.
It is not, unfortunately. I mean, we are encouraging vaccination to help prevent reinfection and believe at this point that is the best advice. It's complicated by the fact that the variants keep changing and the vaccines keep changing. And so getting long-term data on the effect of those, we have to wait for, because every time we make a change, it's a new starting point. So we know, for example, Delta seems to have caused long COVID very effectively, the original strain, and then Omicron and the emerging strains seem to have different sort of scatter patterns in terms of what people are experiencing. They clearly still cause long COVID, but is it the same symptom pattern? Is it the same intensity? More, less, we're not certain.
Well, it's new. You don't have enough data, right? Like you're literally the pioneers of something that we want answers to. Right. So how long have you had your clinic?
So we started the clinic, I think we really started seeing people in late 2020. And initially we thought, we're just going to see a couple of kids. And Dr. Edwards and I we saw all the patients together for about the first year. So we had sort of a shared appointment and gave our perspectives and worked on a treatment plan. And then, we're so in lockstep with what we're doing that we started, and the numbers actually kept increasing. So, we split. And then we have a number of other doctors who we've sort of recruited to be part of our team. So we have a new psychiatrist who's working with us to help. We have a developmental behavioral pediatrician who does hypnosis and biofeedback, who's helping us. We've formed relationships with sleep medicine and cardiology and a number of other departments, so that they start to learn, like, what is long COVID? What does it look like? And we still have a lot of education to do around that, because I think, our patients are still showing up in emergency rooms at times, and at least 2 in the past week have said, they told me I needed therapy because I just had anxiety. And it's really, really maddening. Because
no, I mean, I think, like, it's education. It's really about like looking beyond what the test tells you when they come into the emergency room. But so you've been doing this clinic for a while. Have you seen people graduate?
We have, which is really, really hopeful. I mean, we've seen an array of changes. So some people are really hard to change, but we have absolutely seen people recover. And so we do have sort of a dropout rate to the clinic and try to follow up with those families and make sure they're dropping out because they're well and not for other reasons, access or coverage or something. But we do have people who have gone back to their normal activities and are doing wonderfully. And variable lengths of time, that's the other difficult thing to predict for a family. Like we've had kids who really recover in a couple few months, and then we have people who it's taken 18 months to 2 years for them to really get back on their feet.
And it sounds like from the severity of the symptoms, they vary, number one, but number two, if they are severe, you're going to miss school.
It is a huge disruptor. So this is one of the things we're most worried about is, what is sort of the long-term, plan and outcome for these young people. A number of them have had to drop out of school, and we've sat in on numerous IEP and 504 plan meetings to try to put plans in place for these folks. But many of them have to cut down on their school load. They have to do online schooling. Some of them have to take time off because they can't push that hard, because when they push, they crash and they really can't function. And we really feel like being in that situation is damaging them. So we are going to need, as a society, we're going to need some creative thinking about how do we support these young people through this process.
Okay, I forgot to ask this question. It's not a good wrap-up question, so I'll come up with another last one. But
Okay.
The term brain fog,
Mm-hmm.
like when I had COVID, people asked me, do you have brain fog? And I was like, I don't know what that word means, but yes. So is that one of the symptoms for long COVID also?
That is absolutely one of the big symptoms for long COVID, and what causes it is unclear. There are different theories about that and different things people are measuring, but it is an experience of really not being able to recall things that you used to remember, not being able to take on new information, problems with attention and focus. We've had people who temporarily forget parts of the alphabet. They forget some of the animals' names, their pets' names. I mean, sometimes it's quite profound, the foundational things people forget. More commonly, I think people just describe not being able to focus and concentrate.
Is there any treatment for that in particular?
So sometimes the dietary changes can help. One of the things people are exploring is stimulant medication. So starting, caffeine is something people can start with. I don't want to encourage too much. I would do green tea because that has other health benefits that are, good through the lifespan. But there is sort of work looking at the Ritalin family of drugs, methylphenidate. And then there's some interest in a medication called low-dose naltrexone that, again, remains sort of experimental for this to see if it helps, but it's been around for a long time and
have you prescribed that for anybody and seen any kind of positive?
We've used methylphenidate in a number of patients with success, not with every patient. So again, it's sort of like we try it. Does it work for you? If so, let's keep the minimal dose that makes you feel good without side effects. If it doesn't work for you, let's take it off. And then, we're starting to dip into the LDN, attempts. They are attempts. Like we can't guarantee it's going to help, but again, we try to do what's safe and cost effective and monitor it carefully. Because there aren't, prescription clearly defined practice guidelines for this yet.
Okay, here's my last question. You are an unusual doctor you're an East meets West doctor. Yeah. Are you seeing any Eastern practices, like you're licensed in acupuncture? Are any of those methodologies making a difference here?
Absolutely. So it's been a really good fit for me to do this clinic because this is such a multi-system, multi-dimensional condition where you have to deal from an integrative medicine standpoint with their mind, body, and spirit completely in order to help them get well. One of the main techniques we're using for headache care and for abdominal pain, we're seeing a lot of what's called myofascial pain, muscular connective tissue pain. That there's a technique called gua sha, G-U-A-S-H-A, sort of trending on TikTok for facial gua sha, for facial rejuvenation. We do a bit of a different style of gua sha, but it's a very old technique, low tech, low cost. Families can do it at home, so we try to teach them to do that. So basically a deep tissue technique that's helpful. And then many patients report that acupuncture is really helpful for them. And a lot of the adult patients are being referred to acupuncture because it seems to help with autonomic balancing. It helps with pain control and pain management. It can help with anxiety and depression. And so for patients who have access, we are finding acupuncture to be a wonderful support, and not a cure-all, but a support for many people.
So it's interesting because you may live somewhere where you have nobody who's specializing in this, right? Yeah, but there's a lot of really good advice that you just gave here today that maybe isn't customized to your kid particularly, but also none of it's going to be damaging, like a diet change. it's what we should all be doing anyway, right?
Absolutely. I mean, that's our big hope too, is that, we are inconveniencing these young people, but at the same time, we hope we've established like patterns of eating that will actually prevent them from getting heart disease and diabetes as older people, that this will benefit them throughout the lifespan. So we're being really cautious on our recommendations to make sure they're generally healthy anyway, right? Like modulating your sleep. We should all be doing that. There's not going to be a negative outcome there.
Right. Okay. Well, I'm so grateful for your time, Dr. David Miller, and your training and your breadth of knowledge, and for entering this space, which it's so new and so hard to navigate for parents. So thank you so much for being here with us.
Absolutely. And I encourage people to, try to build community, listen to your kids if they're really not functioning the way they used to. If they're having really strange symptoms, we're having kids having what's called like non-epileptic seizures, where they look like they're having seizures. We have kids with abdominal pain and nausea and things that were never there before. And, we want people to be thinking of long COVID as a cause for those mysterious new symptoms.
I guess in some ways it's comforting, because otherwise you might feel like your kid is falling apart entirely from some well, I guess I don't know how it's comforting to have a reason, but it's not so easy to correct. So
right, but once we know what's going on, then we can actually try, and start, and that's really important.
Thank you so much again, Dr. David Miller. Thanks so much for being here with us.
Thank you for having me. I really appreciate it.